I have a special interest in addiction issues, and addictions are not easy to treat. You need a non-judgmental approach, you need a skillful approach, and you need to work with a wide treatment team, and you need a variety of approaches, and you should work with the families. Now, addictions can be secondary to other conditions. So a person who had childhood trauma and gets nightmares and who's using marijuana every night is using marijuana to sleep and to stop the nightmares. So it's wrong to say you're a marijuana addict or you're abusing marijuana. It would be more correct to say you have discovered that marijuana is a partially effective treatment for your trauma with respect to the insomnia and the nightmares. So by treating your marijuana use, we have to treat the underlying issues of trauma, and we can give medications to help you sleep, psychotherapy to deal with the trauma, and then gradually you can come off the marijuana. So often abuse of alcohol and substances is secondary to an underlying mental health issue that they're trying to medicate, or it may have started off as a medication of a mental health issue and then developed legs of its own and then became an independent issue, even if the mental health issue goes once the addiction becomes entrenched. There are specific psychological treatments for addictions. There are specific pharmacological treatments for the different addictions. For example, naltrexone, Antabuse and Campril for alcohol, or baclofen is being used in some circles. There are trials on the use of lisdexamphetamine as a substitution treatment for methamphetamine. For a long time we've used naltrexone and methadone as substitute treatments for opiates. So you use your medications, you treat the mental health, you do the psychotherapy, you do the drug and alcohol counselling. You also work with the families because the families are often traumatised and caught up in the addiction, and they need support and they need upskilling in the best way to deal with the situation. Sometimes we need hospitalisation to treat the acute intoxication and then to stabilise the condition, and sometimes we need long-term rehabilitation in a safe environment where you can't get access to a substance or alcohol to do the work on all of the issues that are going to cause you to relapse. It's a very common condition. I mean, when I first came down to Bunbury a couple of years ago, tests of the sewerage in Bunbury indicated that it was the #1 methamphetamine using location in Australia. I think it's now down to #2, but it's still in the top 10. So there's a lot of drug and alcohol issues in our community. There's a lot in the southwest. It doesn't spare social class, and it's also an issue for teenagers and people of all ages.